When I was younger, my mom didn't have a job as she was going through law school. We had barely enough money for rent, food, and clothes. There was no spare money for healthcare. My mom was able to get me and my sister on a healthcare plan called CHIP. However, she was not insured. For close to 7 years, she avoided going to the doctor because it was far too much money than we could spend.
Many adults are in the same position in the United States. In fact, the United States Census Bureau recorded that 8.5% of Americans don't have health care and aren't insured.
That is 27.5 million people that are unable to receive health care they need.
In fact, compared to all other high-income countries, the United States dramatically surpasses all nations with the highest costs. In a survey conducted in 11 countries, it was discovered that young adults in the USA are far more likely to go without health care because of costs.
The average cost of health care for an individual is $456.
That is roughly $1,152 per family.
It's no wonder that healthcare in America was recorded to be 3 times more expensive than the cost of education.
Just as school is a necessity, healthcare is as well. It should be prioritized as essential for every American citizen to have access to affordable healthcare.
Many states such as Hawaii, Iowa, and Minnesota have adopted healthcare plans that come with very low and affordable rates. They should be examples in starting a trend of receiving more affordable healthcare.
When voting in this 2020 election, choose someone who is willing to make these strides towards better healthcare in the U.S. In the upcoming Congress elections, also pay attention to who will focus on what America truly needs to address healthcare.
Many Americans are trapped not being able to receive the medical care they need because of the outlandish expenses attached to it. The USA is known to be a place for people to start a life and be successful and thrive.
However, this theme does not apply to those who barely have enough money for food and clothes, let alone healthcare. It should be a top priority for the government to address and provide solutions to this pressing problem.